Hi, my name's Tara, and I'm going to be talking with you today. Could you imagine going to work and not being able to communicate? Imagine you not having the proper communication skills to make your patients feel comfortable during their visits. Communication is vital to the hospital and doctors' offices. Communication is central to electro-neurodiagnostic technology. By evaluating verbal and nonverbal communication with patients and staff to have an understanding on what is going on around the office or hospital. Continuing communication education is vital to keep everything flowing properly. By having trainings and seminars at work to keep employees maintained on proper communication protocols, to keep patients safe and knowledgeable about their own health care. Communication is central to electro-neurodiagnostic technology. As stated in Communication Matters, 3rd edition by Corey Floyd, there are multiple kinds of communication, such as verbal, which are sounds and words to express yourself, nonverbal, which are facial expressions, body movements, posture, gestures, and eye contact, listening, which is actively listening to your patients and staff members to actually listen to what they're saying. In culture, which there's several different culture differences, but a big one is if a patient were to come in that has a different culture than you, and learning about those ahead of time would be helpful. And then language is another one, and that there could be several different language barriers, but if we learn foreign languages or have interpreters and translators, then that could help that a lot too. All of these are vital to electro-neurodiagnostic technology. We work as a team in a hospital setting or doctor's office. In Collaborating in Healthcare, Reinterpreting Therapeutic Relationships by Ann Crocker et al., working together will help achieve the best end result for our patients. Communicating effectively with doctors, nurses, and all members of the healthcare team will be beneficial for the patient. In agreement with Communication Competence by Annegret F. Hanawa and Brian H. Spitzberg, communication is vital to health and helps us interpret what is going on with our patients. Communication helps us build relationships with our patients and build trust with them before procedures. Let me explain why you should learn to be a better communicator. As stated in Introduction to Healthcare for Interpreters and Translators by Nick Creasy et al., learning a foreign language will be beneficial when communicating to all types of patients. Utilizing interpreters and translators are important to communicate effectively to our patients. This is extremely important because we want our patients to be safe. Another reason you should learn to be a better communicator on the job is your patients count on you. Health literacy improves when you do. Going to continuing education classes and seminars can make a life-changing difference. In this image, created by the CDC, we see that low health literacy can cause more ER visits, longer hospital stays, and patients are less likely to follow treatment plans and have higher mortality rates. Now that we have discussed why communication is important and central to electro-neurodiagnostic technology, and why it is vital to learn more about communication to help our patients and benefit them, I want you to think, what should you do next?